Good morning, everyone. This is Sumit, and today we're going to learn about pacing, how to use Zoll for pacing. So let's very first talk about people who need pacing. So patients with symptomatic bradycardia or patients who are not responding to atropine in a third-degree block requires pacing. So we do two kinds of pacing, transcutaneous and transvenous. Today we're going to talk about transcutaneous pacing. So for these patients, when we're going to pace them, transcutaneous pacing can be painful. So ask your doctor to order some pain medication for these patients. So when you first see the patient, you bring them into the room, undress the patient, make sure you put them on a cardiac monitor, get 2 large bore IVs, and then you're going to put them on a crash cart monitor, that's Zoll. So when we're going to put them on a monitor, these pads, the one goes in the front at the heart level and the second one goes on the posterior at the same level. So we make the sandwich of the patient's chest to pace them. And make sure these patients, along with the pacer pads, they are connected to the 3 leads of the Zoll monitor. So when we get the capture, we can observe them on the monitor. So I want to show you about the Zoll monitor. So very first, you can see there are 3 sections: monitor, defib, and pacer. So as we are going to pace this patient, so I'm going to turn it on a pacer. Under pacer, it's green in color, and everything in green in color, we're going to use it for pacing. So there are milliamps output, and then there is a rate. Those 2 things we can change on it. So very first, it's going to default it to 0 milliamps, and the rate is usually 70 for the better cardiac output on these patients. So when we're going to try to capture, we're going to do the clockwise turn on the milliamps to get the capture. Just keep going up until you get the capture. So like over here, we start getting the capture. The capture is going to show up by the downward spikes followed by a widened QRS complex and extended T wave. So as we start capturing here, we're going to go slowly down as you just lose the capture. So as we just lost the capture over here, now we're going to go up by 10% in milliamps to keep the capture. So going down, that is usually the threshold for the people. So this, we go up 10% just to keep the capture. So you see this button 4 to 1. When you're going to press and hold this button, it's going to show you the baseline rhythm of the patient without losing the capture. So if the doctor walk in and they want to see the baseline rhythm of the patient, you don't need to go down on a milliamp to show them the rhythm. You can just press and hold this button and you can see the baseline rhythm, and let go of it and you will see your capture again. So just want to repeat, the capture will be shown as a downward spikes followed by a widened QRS complex, and it's going to be extended T wave.